Well, thanks very much for that. I have to say there are some events that I enjoy doing more than others in this job, and this is certainly one of those. It's an issue that's very close to my heart, something that I have spent a big part of my professional life doing, and I do have an abiding interest and commitment to the issue. So as you've just heard, before I entered Parliament, I worked in the area of a range of jobs, but when I moved into public health, a big part of my focus was in the area of drugs and alcohol. I spent a few years at Turning Point doing some research on methadone takeaway doses. I went on and took up an appointment with the Nossal Institute, where we were lucky enough to get some money from the Gates Foundation and establish, basically through the under the umbrella of HIV prevention, a buprenorphine-based drug substitution program in northeast India, which we managed to establish with the drug-using community in that area, and it's one of the great success stories in terms of development in that region. And then before I took up my job, I spent a few days in Geelong as a drug and alcohol clinician, essentially being a methadone prescriber. So it is an issue I've spent a lot of time working on, and I do take those experiences into the Parliament. But it is unfortunate that I've entered the Parliament at a time when it seems almost impossible to be able to have a sensible discussion about any big reform, let alone a reform agenda that's as contentious as this one. It hasn't always been like that, though, and I think we should take heart in that. We should take heart in the fact that in the latter part of the last century, Australia really led the way when it came to the issue of drug reform and harm reduction specifically. We, in response to the HIV epidemic, were one of the first countries to introduce needle and syringe exchange as a harm reduction measure, and it's been incredibly successful. In my view, it's one of the great public health success stories of this nation, and it's something we hear very little about. I'll talk a little bit about what some of the things that have been achieved as a result of needle and syringe exchange in a minute. We had the heroin trial, the latter part of the 90s, where there was a big move to introduce a heroin trial into the ACT. Of course, that was eventually knocked on the head when the Howard government took over, basically using Commonwealth powers to override the territory legislation. And, you know, it's easy to forget that in the 1999 state election campaign, the then opposition leader, Steve Bracks, said we were going to have a number of supervised injecting facilities introduced in Victoria if they were elected. It was a response to the number of heroin overdose deaths at the time. Of course, that never came to pass. There was some pressure on the government at the time, and unfortunately they folded. The reasons for why this is a difficult area at the moment, I think they're varied. There's a lot of blame on the media and the 24-hour news cycle and the sort of pressure that puts politicians under. I think that's true. I think that's true to some degree, but there's always been pressure from the media, and it's really important that when you take up this job, you demonstrate some courage and leadership on issues just like this. I think there's also, in my view, this sort of anti-science sentiment emerging in Canberra. You see it in the response to climate change, where ideology is sort of, you know, trumps science and evidence. And it's a really worrying trend in Canberra. I hope it's something that's going to pass, but at the moment we're certainly in the grips of that. And you sort of, I think underpinning all of this is the fact that we're dealing with a problem that the people in Canberra, and one of the things that struck me when I took up my post last year, is they're essentially sort of middle-aged, sometimes a little older, men in their 50s, 60s, often from a fairly privileged background, usually white, Anglo, who don't have any personal experience or connection to the issue, except for the few that may have an immediate connection with a member of their family. So there's this huge generational gap, and you only have to look at patterns of drug use to see that, of course, prevalence is much higher in those younger age groups. So there's also that thing where there's not that direct connection and experience to the issue, and I think that plays a part in it. It's certainly dangerous territory for me to get into as a poly and particularly a Green politician. We've been pilloried in the past for taking this issue on. We've got a campaign at the moment where the News Limited have said explicitly in their editorials that they're ambition is to destroy the Greens at the ballot box. And for me, on an issue like this, it's actually quite liberating, because if you're going to have a fight with people on an issue and in the media, you might as well take them on over an issue of substance. They're not going to like us regardless of what we say, so why not enter into this sort of territory, given it's an area that I've had some experience in and am very committed to. I think it's really important also to put for all of us as policymakers, to put the issue into some sort of perspective and context. And as I said, I think politicians in Canberra often don't put this issue in its proper context. Whenever you have a debate about illicit drugs, I always talk about the harms associated with alcohol and tobacco, so that there's a clear understanding that we've got huge problems around drugs, not just illicit drugs, but licit ones, and in fact the greatest burden of disease and cost associated with drugs comes from alcohol and tobacco. I mean, you look at the numbers, you're talking about close to 2/3 of all healthcare costs, lost productivity, and some of the intangible costs come from tobacco. You're approaching 1/3 of the costs coming from alcohol, and then when you look at the costs associated with illicit drug use, it's only a small fraction of that, somewhere in the order of 10 to 15%. Now, what that does is, of course, it means we've got to take action on alcohol and tobacco, and we've been very active in that area. We have, been very vocal in our support of the government's plain packaging legislation, for example. That was a very good reform, and we're really pleased the government took that on. There are some other areas around tobacco, but there seems to be a very clear agenda to try and do something about tobacco. But on alcohol, the government is certainly dragging their heels, and the opposition shows no sign of being any more courageous in that respect. We've been pushing for more appropriate pricing, to use price as a classic public health lever. We use it in tobacco. Why not in alcohol, to ensure we get volumetric pricing, labelling. Government's very reluctant to move into the area of appropriate labelling around alcohol products. There's issues like sponsorship and sport and so on, and they're all issues we've been very active in. I suppose one of the big differences with illicit drugs, though, is illicit drugs are looked at through a very different prism. They're looked at through the law and order prism, and that is where we start diverging in terms of our responses. And so you've got a situation where, and I was interested to look at the number of people who were arrested for an illicit drug offence in 2010, and 85,000 people arrested for an illicit drug offence in this country, where over 80% of those arrests were just for use and possession. It's a huge number of people who have been caught up in this. And if you look at prison stats, there's 1 in 10 people there because they have a primary drug-related offence, and many, many more who are there for other offences that are related to their drug use. So in that context, you ask yourself, well, what's the role of government here? What is the job of government? How should we be responding to a substance or to substances that have the potential for harm? And I suppose on this, I agree a little bit with Malcolm Fraser, who takes that view that one of the roles of true liberal government is to maximise well-being and happiness of a community, and by default to reduce harm. And that's, I suppose, one of the principles of harm reduction. And that's my view around illicit drugs, is we need to look at how is it that we can maximise well-being and reduce harm when we talk about the illicit drug issue. The first thing I think to acknowledge is that it's a complex area. There are risks associated with specific drugs, and there are risks associated with specific patterns of use, and you can't have a sort of a monolithic response to this issue. I know that it's important to put the risk in its proper context, and I know that can sometimes get people into trouble. Professor David Nutt, who chaired the Advisory Council to the UK on the misuse of substances, he was a senior figure within the British government. He decided to write a piece which compared ecstasy use to horse riding and compared the harms associated with each of those activities. And he got into all manner of strife for doing that because, politicians on both sides accused him of sending the wrong message, of essentially trivialising drug use. But it is important that we deal with facts. I think it is absolutely critical that we deal with facts, and we need to understand that there are different harms associated with different drugs and certainly different patterns of drug use. We have this image of the drug user as somebody who's homeless, dependent, whose life's been dramatically affected by their drug use, and that's true. I saw a lot of people like that in my medical practice or my health practice, where people would often say to me, "Gee, you work in a very depressing area, the area of substance dependence, and you must see a lot of heroin addicts, and gee, that must be a horrible work environment." And I have to say, of all the jobs I did, it was one of the most rewarding, because it was one of the few areas where people would come in to see you, where their life was literally, and I think we heard earlier about what it actually means to be a heroin addict. We're not talking about people who are injecting heroin because it's fun. We're talking about people who are doing it essentially to keep themselves well. People get very, very sick when they don't get their heroin or their opiate. And to be able to provide a medication, essentially a legal opiate, which is what methadone and buprenorphine both are, and to actually help somebody who may have lost their job, their home, and so on, all of their relationships, to once again become, a functional member of society again. Very, very few jobs that give you the opportunity to make that sort of transformation in someone's life. So I found it a tremendously rewarding and sometimes frustrating, and all the stuff that I know you guys feel probably every day. But that's just one end of the sort of drug using continuum. There are people, and the truth, again, the reality is that there are many functional drug users. They use drugs sometimes occasionally, sometimes more often, productive lives, work, successful relationships, and so on. So we need to make sure that the response to drug use is a nuanced one. And of course, we heard a little bit about the problem of prescription drugs. I saw a number of people, young kids, who were getting their codeine in naproxen preparations and taking bucket loads of them. And their first presentation would be because they had a perforated peptic ulcer and were about to die in the emergency department. It was only then you discovered that it was the codeine that people were taking in those preparations. So it is a very complex issue, and I don't come at it from a narrow ideological viewpoint. I think evidence is the key here. I don't think that the current approach is working. I think the approach that sees this issue through the prism of a law and order problem is flawed, and you've heard about all of the reasons, I'm sure, previously about why that's the case. Essentially, that approach increases the harms associated with the use of illicit substances. But I don't come at it from some libertarian view either. I don't think the answer is to do what some people advocate, which is make drugs legal, tax them, put them in the hands of large companies, and essentially sell them in the same way as we do other products like tobacco and alcohol. I think there are good lessons to be learnt there about what not to do. So I think the approach has to be a lot more nuanced. First thing we've got to do is we've got to invest in the things that we know work. Why on earth is it that methadone, we treat substance dependence as a medical issue, it's acknowledged as a medical issue, it's treated within the medical model, and yet people who come to get their methadone are forced to pay for that medication in a way that we don't expect of anybody else. If this was somebody with diabetes, if this was somebody who had heart disease, it would be unthinkable that we'd be charging them $5 every day, $35 a week. People will often say, well, you know, they're spending a lot more on their drugs. Well, this is a time when somebody's trying to make the transition to find a rental property, get into the housing market, get into the job market. They're on often a small payment, some sort of Centrelink benefit, and we're ripping most of that away so that they can pay for their medication that's essentially keeping them off drugs. Doesn't make sense. Methadone should be listed on the PBS. And we've heard a whole range of other, I'm not going to go into great detail, but a whole range of other harm reduction initiatives that must be supported. The issue of needle and syringe exchange. I mean, we're talking about an intervention that over the course of the last decade stopped 30,000 cases of HIV being transmitted and almost 100,000 cases of hepatitis C. Huge return on investment, almost 30-to-1 return on investment. Savings of billions of dollars in terms of healthcare costs and lost productivity. Why aren't we investing more in needle and syringe exchange, getting a quality framework, paying people who work in this area more, ensuring that we get better data collection and research, ensuring that there's awareness amongst users and so on. There's the issue of needle and syringe exchange in prisons. Why is it that we continue to stick our head in the sand when it comes to providing needle and syringe exchange in prisons? I know the ACT has been on the verge of a trial for some time, and I know there have been some players in that debate who have, in my view, been, well, I'll say disappointing in terms of their response to where that's going. In Victoria here, only recently we saw a prison officer receive a needle stick injury. And the idea that it's safer to drive this underground and have syringes floating around prisons rather than through a regulated needle and syringe exchange program, it makes no sense at all. A few things, I mean, the medically supervised injecting facility in King's Cross, why don't we have one in every state? Well, no, not one in every state. Centres across each state, right around the country. The evidence is unambiguous about the success of medically supervised injecting facilities. We need to see those evidence-based interventions being implemented. Say something about sniffer dogs. Why on earth do we support a policy that doesn't act as a deterrent, but all that it does is drive drug using to become a much more harmful activity? And of course, education. With education, we've got to make sure that the messages that are communicated are consistent with the experience of drug users. There is a dissonance in terms of the messages that people get, and until you start to bridge that gap, those campaigns will never be effective. And finally, I'll just say a few things about what's happened in Portugal over the past decade. If the idea of treating this as a law and order problem was successful, then what we would have seen in Portugal, who essentially decriminalised possession and use, what we would have seen in Portugal was an explosion in drug use because, of course, penalties would have been acting as some sort of deterrent. We didn't see that. Instead, we saw more people in treatment. We saw a reduction in the spread of HIV. We saw a number of other benefits. And I think there are lessons to be learned in terms of how we respond and what's happened in Portugal. My final comment is this. I've only been in this job a few short months. This is an issue I want to bring onto the national agenda. I don't have many friends who are going to join me. I have a few. There is a parliamentary friendship group with people from both sides. Not many of us, but quietly there are people who support this, my response to this issue. But we can't do it unless the community that works in this space, that lives in this space, becomes active and supports those few politicians who are willing to stand up. You do need in this job support from people like you when we're going to put our necks out and get pilloried by the mainstream press. And if there's one thing I can leave you with, it is get active and make sure that you're a big part of the debate, because without your help, we're not going to get anywhere. Thank you.